All right, Peter Van Dusen, we see the Prime Minister at the microphone. Let's listen in.
Over the past few days, we've seen COVID-19 spread around the world at an even faster pace. Canada is no exception. From the very beginning of the outbreak, our government took necessary measures to protect your health and safety. We've based our response on science and evidence, on input from our world-class health professionals and authorities. We continue to base our response on keeping Canadians as protected and as supported as possible. We assured you that as the situation evolved, our response would evolve too. As the virus continues its spread, we've decided to take increasingly aggressive steps to keep you and your family safe. D'abord, nous fermerons nos frontières aux gens qui ne sont pas citoyens aux résidents permanents du Canada. Cette mesure prévoit certaines exceptions désignées pour notamment les membres de l'équipage, les diplomates, ceux dont la famille immédiate est canadienne et pour l'instant, les citoyens américains. First, we will be denying entry to Canada to people who are not Canadian citizens or permanent residents. This measure will carve out some designated exceptions, including for air crews, diplomats, immediate family members of Canadian citizens, and, at this time, U.S. citizens. Deuxièmement, les compagnies aériennes recevront le mandat formel d'interdire à tous les voyageurs présentant des symptômes de la COVID-19 de monter dans un avion. Les compagnies aériennes effectueront une évaluation de base de la santé de chaque passager selon les recommandations de l'Agence de la santé publique du Canada. Ça veut dire que toute personne présentant des symptômes ne pourra pas entrer au Canada. Je sais que c'est une nouvelle qui va provoquer des inquiétudes pour beaucoup de Canadiens qui sont à l'étranger. Je veux vous assurer que notre gouvernement va continuer de vous appuyer. Pour aider les Canadiens asymptomatiques à rentrer au pays, notre gouvernement mettra sur pied un programme d'aide pour les Canadiens à l'étranger. Les voyageurs canadiens pourront obtenir du financement pour les aider à rentrer au Canada ou couvrir les coûts essentiels en attendant de revenir au pays. Second, air operators will be formally mandated to prevent all travelers who present symptoms of COVID-19 to board a plane. Air operators will be required to complete a basic health assessment of every air traveler based on guidance from the Public Health Agency of Canada. This means that anyone who has symptoms will not be able to come to Canada. I know this news will spark concern among Canadians traveling abroad. I want to assure you that our government will not leave you unsupported. To help asymptomatic Canadians return home, our government will set up a support program for Canadians who need to get on a plane. Canadian travelers will be able to get financial assistance to help them with the costs of returning home or temporarily covering their basic needs while they wait to come back to Canada. Troisièmement, à partir du mercredi 18 mars, seulement 4 aéroports canadiens accepteront les vols internationaux. L'aéroport Pearson de Toronto, l'aéroport Montréal-Trudeau, l'aéroport international de Vancouver et l'aéroport international de Calgary. Pour l'instant, les vols domestiques ainsi que les vols en provenance des États-Unis, du Mexique, des Caraïbes et de Saint-Pierre-et-Miquelon ne seront pas touchés par cette mesure. Les restrictions de voyage annoncées aujourd'hui ne s'appliqueront pas au commerce et aux échanges. Nous continuons de faire en sorte que le Canada puisse continuer à recevoir les marchandises importantes. Third, starting Wednesday, March 18th, only 4 Canadian airports will be accepting international flights: Toronto Pearson, Montreal Trudeau, Vancouver International Airport, and Calgary International Airport. At this time, domestic flights, as well as flights coming from the U.S., Mexico, the Caribbean, and Saint-Pierre-et-Miquelon, will not be affected. The travel restrictions announced today will not apply to commerce or trade. We will continue to ensure the supply of important goods to Canada. I know that these measures are far-reaching. They are exceptional circumstances calling for exceptional measures. Earlier today, I had a call with our G7 partners to inform them of these important changes. From the very beginning, Canada's response has been based on the latest available science and advice from our world-class health professionals. Today's announcement is no different. These measures will help save lives. Depuis le début, c'était important pour moi que les Canadiens aient accès aux recommandations des experts et des professionnels de la santé. C'est leur savoir et leur expertise qui guident les démarches non seulement entreprises par les gouvernements, mais par les individus. La Dr Tam, les professionnels de la santé publique et nos ministres font un travail extraordinaire pour protéger la santé des Canadiens et les garder au courant des derniers développements sur une base régulière. Comme la Dr Tam l'a dit hier, les autorités de la santé publique ont administré 25 000 tests à date et leur travail continue. Pour assurer que le plus grand nombre de Canadiens possible puissent avoir accès aux dernières informations, Santé Canada fera sa mise au point quotidienne au même endroit et à midi à partir de demain. Aujourd'hui, leur point de presse suivra immédiatement la mienne. Dr. Tam, public health officials and our ministers have been doing a tremendous job of keeping people safe and providing regular updates. As Dr. Tam said yesterday, public health authorities have conducted 25,000 tests to date, and this work continues. To ensure that more Canadians can have access to the latest information on COVID-19, Health Canada will be holding its daily update at the same place at noon, starting tomorrow. Today, their press conference will take place after my remarks. Les mesures annoncées aujourd'hui s'ajoutent à tout ce que notre gouvernement a fait jusqu'à présent. Vendredi dernier, le ministre Morneau a annoncé des nouvelles mesures pour appuyer financièrement les travailleurs et les employeurs à travers le pays. We will make $10 billion available in additional support for Canadian businesses. This is a tool that has worked before in difficult circumstances, and we're confident that it is going to work again. The economic impact of this pandemic is shifting hourly, and we recognize the stress and anxiety that it is causing. As I've said, we are prepared to see Canadians through this time. We will have additional measures to announce as early as tomorrow to support Canadians, particularly our most vulnerable. Right now, provinces and territories are facing different realities and risks, which means taking steps that make sense for people in each area. At the same time, we also need to keep building an aligned, Canada-wide approach. On Friday, I held a telephone meeting with the Premiers and Deputy Prime Minister Freeland, and information has been flowing continuously since. We've been in constant communication with the provinces and territories so that there are no barriers between our jurisdictions during this critical time. During the meeting, I spoke to premiers about the $1 billion COVID-19 response fund our government has put in place, which includes support for provinces and territories and their healthcare systems so hospitals can prepare. We can still slow the spread of this virus, but as Dr. Tam said, that window is closing. So far, we've seen many provinces take aggressive steps to protect their communities. I want to thank them for their work. It's time to take every precaution to keep people safe. The COVID-19 Response Fund also includes support for Indigenous communities. On Friday, I spoke with First Nations, Inuit, and Métis Nation leaders to discuss the work we're doing together on preparedness and mitigation efforts. Minister Miller also provided an update on our regular coordination with Indigenous partners, as well as the provinces and territories. Minister Van Daal has also been connecting with the territories and is working on exceptional measures to protect the North. We're making sure that everyone, no matter where they live, is prepared. Les mesures annoncées aujourd'hui s'ajoutent aux recommandations émises par les professionnels de la santé publique. Je tiens à rappeler à tous les Canadiens qu'ils devraient éviter les voyages non essentiels à l'extérieur du pays jusqu'à nouvel ordre. Nous recommandons également à tous ceux et celles qui sont présentement à l'étranger de rentrer au pays alors qu'il est toujours possible de le faire. je vais être clair. Si vous êtes à l'étranger, il est temps de rentrer chez vous. Si vous venez de rentrer, vous devez vous isoler pendant 14 jours. Et finalement, tous les Canadiens devraient rester chez eux. En restant chez vous, vous pouvez non seulement protéger votre santé et celle de vos proches, mais faire en sorte que nos professionnels de la santé et nos systèmes de santé puissent aider davantage ceux qui en ont besoin. I want to remind all Canadians that they should avoid non-essential travel outside of our country until further notice. Canadian travelers should return to Canada via commercial means while it is still possible to do so. Let me be clear. If you're abroad, it's time for you to come home. If you've just arrived, you must self-isolate for 14 days. And finally, all Canadians, as much as possible, should stay home. By staying home, you can not only protect your health and that of those around you, but ensure that our healthcare professionals and our healthcare systems can focus on those who need their help. This is an adjustment for all of us. We know that staying home is an important step to protect the community and each other. We all have to do it. But I want to remind all Canadians that social distancing doesn't mean we have to stop talking to each other. Pick up the phone, write an email, FaceTime. The strength of our country is our capacity to come together and care for each other, especially in times of need. So call your friends, check in with your family, think of your community. Buy only what you need at the store. But if you're heading out to grab groceries, ask your neighbor if you can get them anything. And if you know someone who is working on the front lines, send them a thank you. See how they're holding up. In Canada, we're lucky to have outstanding healthcare professionals. I want to thank them once again for their tireless efforts to keep us all safe. At the same time, our government is doing everything it needs to do to keep you safe, to keep your family safe, and to keep our economy strong. No matter what our next steps look like, you can rest assured that we will take them together, with premiers and mayors, with doctors and families and neighbours, because that is what Canadians do in difficult times. We pull together and we look after each other. Merci beaucoup tout le monde.
Bonjour, Louis Blouin de Radio-Canada. Monsieur Trudeau, la réponse de votre gouvernement, elle est critiquée. Il y a des gens qui jugent que ce que vous annoncez aujourd'hui, ça vient beaucoup trop tard, que les contrôles aussi qui ont été réalisés dans les aéroports ont été laxistes. Ma question, est-ce que vous assumez la moindre responsabilité pour ce que plusieurs considèrent comme des ratés de votre gouvernement?
Nous comprenons que la situation évolue extrêmement rapidement. On a pris des mesures importantes au cours des derniers jours et on continue à prendre des mesures importantes aujourd'hui. Je comprends la préoccupation des gens, mais je peux vous rassurer que les mesures sont en place pour nous garder en sécurité.
Donc, juste pour...
Okay. I will highlight that the situation, as we all know, has been evolving extremely rapidly. We've taken measures over the past number of days to keep Canadians safe, and we're taking more measures, significant measures today. I can understand people's frustration, and that's why we're ensuring that there is more that will be done every step of the way to keep Canadians safe.
Juste pour être clair, donc vous n'admettez aucune erreur?
Écoutez, il y a toujours des choses qu'on doit faire et on va continuer d'en faire plus à tous les jours.
Sur la question des États-Unis, pourquoi ne pas inclure les États-Unis? Puis qu'est-ce qui entre dans l'équation?
Nous coordonnons extrêmement attentivement avec les États-Unis. J'ai parlé plusieurs fois au cours des derniers jours avec le président Trump. Nous allons reconnaître l'intégration de nos deux pays à tellement d'égards que ça exige un niveau de coordination particulier pour les prochaines étapes et on est en train de le faire.
Glenn McGregor, CTV News. Prime Minister, you've been telling us for several weeks now that a travel ban was not required, that it wasn't helpful. What changed your mind overnight, and do you regret not acting sooner to take this step that's taken by other jurisdictions, other countries?
This situation, as everyone knows, has been evolving extremely rapidly, and the recommendations of public health and public safety have been evolving as well. At every step, we've taken the best advice of our public health officials, and now is the time to take this particular step. It is a significant step. It is a step that we take in exceptional circumstances, but it is the right step to be taking today.
Another brutal day on the stock markets this morning. TSX is down 7% just this morning, actually almost 8%. What is your message to Canadians who are seeing their retirement savings being wiped away, and especially those who are thinking of retiring in the near future?
Our focus right now is on ensuring that Canadians who are staying home from work have enough money to be able to buy groceries and pay their rent. These are measures that we will be moving forward with in the coming days to ensure that people can keep themselves and their loved ones safe and healthy. We will, of course, be moving towards supporting businesses, as we already have, with significant access to credit of $10 billion and other measures to ensure that in the short term we are able to continue to support each other. In the medium term and then into the long term, we will need to invest significant amounts to restore people's confidence in the economy, to restore the kind of growth that is going to ensure a better future for all Canadians, and we will do those things as we need.
De TVA, pour continuer sur la même veine, je comprends qu'il y a des annonces qui s'en viennent pour ce qui est de l'aide aux familles spécifiquement, mais pouvez-vous dire aux Canadiens, aux familles qui ont besoin d'aide, à quel moment elles pourront toucher l'argent?
On va rendre de l'argent accessible pour nos familles les plus vulnérables dans les jours à venir. On comprend qu'il y a énormément de gens qui sont extrêmement inquiets pour la capacité de nourrir leur famille, de payer leur loyer, des préoccupations extrêmement concrètes, particulièrement pour des gens qui n'ont pas l'assurance emploi, qui sont dans des emplois vulnérables ou à temps partiel. C'est pour ça qu'on va avoir des annonces à faire dans les jours à venir qui vont démontrer que ces gens vont avoir de l'argent nécessaire pour passer à travers des semaines à venir.
Est-ce que les gens pourront avoir l'argent?
On va annoncer dans les prochains jours ces mesures-là.
Minister, public health officials say many of the new cases can be traced to the U.S. Why are U.S. citizens exempt from entry restrictions to Canada?
We've been collaborating very closely with the United States, coordinating various measures that we've taken together. The level of integration of our two countries is quite particular, which is why we need to do some more work in order to ensure that we're doing what we need to do in the right way. But our first preoccupation is and always will be the continued safety of Canadians, and we will take the measures necessary to keep Canadians safe.
But then why are U.S. citizens being allowed into Canada? What does this mean for the U.S. border? Is it going to be closed at all? At
this point, we are closing our borders to all non-Canadian or non-permanent residents of Canada. We are recognizing that for the moment that measure does not apply to U.S. citizens, but we will have more work to do in the coming days to ensure that we're doing everything we need to do to keep Canadians safe and to ensure the flow of goods and necessary equipment to Canadians.
De la presse. Donc, vous gardez la possibilité de fermer la frontière canado-américaine. Quel sera l'élément déclencheur pour fermer cette frontière avec les États-Unis?
Comme j'ai dit, à chaque étape, nous ne fermons pas la porte à aucune mesure qui pourrait garder les Canadiens en sécurité. Nous allons faire les évaluations étape par étape sur la meilleure façon de nous garder en sécurité. On a pris une grosse étape aujourd'hui. Il va y avoir d'autres choses à annoncer dans les jours à venir sur différents niveaux. On va à chaque fois faire l'évaluation de comment mieux protéger les Canadiens, comment garder notre pays, notre économie, nos citoyens en sécurité et assurer l'intégrité et le bon fonctionnement de notre système de santé.
À l'heure actuelle, l'épicentre de la pandémie est en Europe. Certains craignent que ce soit bientôt les Américains, les États-Unis. Est-ce que c'est pour ça que vous gardez la porte ouverte à fermer la frontière avec les États-Unis?
Comme j'ai dit, on ne ferme pas la porte à aucune mesure. Tout est sur la table pour protéger les Canadiens, mais on va y aller étape par étape, comme on a fait depuis le début, pour prendre les mesures nécessaires au moment où ils seront nécessaires.
said that your decisions thus far have been dictated by science. What is the science behind leaving the U.S. border open but denying entry to other travelers?
We recognize that the level of integration of our two economies and the coordination that we've had over the past while puts the U.S. in a separate category from the rest of the world. But we will continue to coordinate with the U.S. We will continue to examine next steps and measures that must be taken. Today we are announcing that we are closing our borders to all foreign nationals from everywhere around the world. We will have more announcements to make in the coming days as this situation evolves.
You said also that citizens have to, people returning to Canada must self-isolate for 14 days. Are you preparing any measures to ensure that they do that, or is this still voluntary?
If we put in measures for mandatory self-isolation, as many people have looked for, there would need to be enforcement measures around that, both by public health and by public safety. We know that at this point, the expectation that people self-isolate is something that we've asked of Canadians around the country, that we are expecting people to do. We know that Canadians want to keep themselves and their families safe, and we are confident that people will do what is necessary to keep themselves, their loved ones, and their neighborhoods safe.
Christopher Nardi, National Post. On Friday, Health Minister Patty Hajdu said, and I quote, "Canadians think we can stop this at the border, but what we see is a global pandemic, which means that border measures are highly ineffective and, in some cases, can create harm. We see that in countries that had the worst expressions had the tightest borders. What changed?"
We have seen over time various countries take very stiff border measures that proved ineffective. In Canada, we based our decisions on public health recommendations that ensured that Canada's approach worked for many, many weeks in keeping a very slow spread of the virus in Canada through contact tracing and other measures. We've now come to the point where the best advice from public health officials is that additional border measures on top of the social distancing measures that we are encouraging domestically is the right combination to move forward now.
How we've seen throughout the weekend complaints that airports weren't able to keep up, they weren't advising travelers. What makes you think that suddenly closing the border and redirecting flights to four places, the bureaucracy will be able to adapt and actually enforce these measures?
We've already seen shifts at the airports where every single traveler gets asked if they have symptoms, gets asked to acknowledge that they've been asked to self-isolate. We will be putting forward more support in those four airports as well. I want to highlight that local jurisdictions are also stepping up to assist in those four airports. We know that there is much more that we can do, and that's what we are doing.
Journal de Montréal. Il y a un haut fonctionnaire de l'OMS qui a dit dans les dernières heures, je vais le citer, le problème qu'on a dans la société actuellement, c'est que tout le monde a peur de faire une erreur et des conséquences que cela pourrait avoir. Mais la plus grande erreur est de ne pas agir, d'être paralysé par la peur d'échouer. Est-ce que c'est une critique qui s'applique à votre gouvernement, à votre pays?
Au contraire, à chaque étape, on a pris les mesures nécessaires recommandées par les meilleurs experts pour garder les Canadiens en sécurité. Et c'est une des raisons pour laquelle, depuis le début de cette crise du virus, on a vu des mesures qui ont fonctionné au Canada. On a une trajectoire qui a été plus basse qu'ailleurs dans les pays occidentaux. On a pris des mesures additionnelles aujourd'hui parce que c'était le temps qu'on les prenne. On a eu une rencontre du cabinet hier soir où on a discuté longuement de la science et des recommandations. Et on est confiant qu'on est en train de faire ce qui est nécessaire pour garder les Canadiens en sécurité aujourd'hui. Mais comme on sait, on est dans une situation qui évolue constamment et on va vous mettre à jour au fur et à mesure qu'on prend des mesures additionnelles.
Vous dites que vous vous fiez aux meilleurs experts, aux experts en santé publique, mais tous ne s'entendent pas non plus nécessairement sur les mesures à prendre. Est-ce qu'il n'y a pas un moment où des décisions politiques doivent être prises pour rassurer la population?
Ultimement, les décisions sont prises pas par les scientifiques, mais par des personnes élues pour servir les Canadiens. Et ça, il y a toujours un élément de cette discussion qui doit prendre en compte les inquiétudes et les comportements des citoyens. Ça fait partie de notre responsabilité en tant que gouvernement et c'est exactement ce qu'on a fait. Merci beaucoup tout le monde. Bonne journée.
All right, Peter Van Dusen watching along with you, and the Prime Minister announcing measures that go further than most people had been reporting or most speculation had pegged, and that chief among them, the border, closing to everyone except Canadians or family members of Canadians who are non-citizens, and Americans for the time being, the Prime Minister said. So the border open to Canadians and Americans largely only. And some of the other exceptions include diplomats and flight crews. In a couple of seconds, we'll be moving to the National Press Theatre, where a number of different cabinet ministers will be at that table to answer more details about what's been announced today from Justin Trudeau. And clearly more questions will be asked about the border. And you heard lots of reporters asking questions about, you know, the suggestion from a lot of critics that this measure should have been done weeks ago, that it's coming too late, and wondering why the Americans are being... the Public Health Agency will be done from now on every day at noon to give Canadians the latest on where they're at, although today that update is now following the Prime Minister's comments with cabinet ministers here in the National Press Theatre today at 2 o'clock here in the nation's capital. Martin, what are your thinking? Martin Singer's with me watching along. What are your thoughts as we watch these measures announced today?
Well, the first thing that comes to mind is that the doctors, the health authorities, the epidemiologists are going to say there is a big question here, and that is 24.4 million Americans cross the border to Canada, either in day trips, repeated trips, tourists, or business. And a vast majority of them, many of them were tourists as well. So that's 24.4 million people crossing the border. Even if we assume that a lot of that is drying up, that's still, even on a slow month, almost 1 million to 2 million Americans crossing the border. We know the situation in the United States, so obviously it is a health decision that the Canadian government is going to have to come to. As you mentioned, the Prime Minister was questioned about that. There's a question of trade, but there's also a question of a very large number of people crossing the border. The other interesting announcement, which will be a great help, knowing someone who's tried to leave, who's left Spain, who's now in Slovakia, and is unable to get flights back for the next 2 weeks to Canada, those people trying to return to Canada, he's announced aid for people who to either defray some of their costs in getting back to Canada, or if they are, like my friend who's in Slovakia, under a shutdown, unable to get back to Canada for the next 2 weeks. So that is a very welcome announcement in terms of just small but very important aid for Canadians. If the Prime Minister says it's time to come home, that might help things a bit.
And just keeping, because the story changes so quickly, keeping abreast of sort of developing news as well. Here's what we're hearing out of Alberta. Sources telling the Canadian press, Dr. Dina Hinshaw, who is the public health officer, and she's been the face of the response in Alberta, has now herself been put in self-isolation. So she's been on the front lines of dealing with this outbreak in the province of Alberta. Perhaps you've seen her in those daily briefings. She is, according to Canadian press, in self-isolation. So there's a... I think we're getting an Alberta briefing coming up later today, so we'll have a chance to find out the latest on that, and trying to... You know, this is not unexpected. We've seen these stories of certainly healthcare workers on the front lines, in some cases in critical condition, having been fighting this. Some of them are in the hospital themselves being treated, and that's always a great concern when you have an outbreak such as this and a virus such as this, is the vulnerability and the threat to those people who look to help all of us on the front lines of the healthcare system in this country. And it looks like the medical officer of health in Alberta is herself, perhaps, at this point, one of those casualties, as she has been put herself in isolation. So we'll see where that takes us in that story this afternoon. As we stand by to go to the National Press Theatre for cabinet ministers responding and elaborating on those announcements from the Prime Minister today. How did you think of the way the Prime Minister handled the questions from reporters that basically are questions fueled by the comments we've heard from health professionals in many cases in this country, in some cases opposition parties saying far more needed to be done about the border and why it's taken so long to do it? Well, stand by. So we're going to get to some of those questions again. I think we'll again be asked of the ministers who are gathered here today. You see them, the Public Safety Minister from left to right, Bill Blair, Marc, Garneau, the Transportation Minister, Deputy Prime Minister Chrystia Freeland, Health Minister Patty Hajdu, the Families and Economic Development Minister Jean-Yves Duclos, and we were supposed to see the Public Health Officer there as well, Teresa Tam, and I don't see her there unless she's in. Let's listen in and see what we hear from this news conference.
Has a statement. We'll take 5 questions from the floor, and then we'll go to the teleconference after that.
Okay.
Minister.
Merci beaucoup. Bon après-midi à tous. Aujourd'hui, je suis accompagnée par le ministre de la Santé, de la Sécurité publique, des Transports et par le président du Conseil du Trésor et le vice-président du comité du cabinet sur la COVID-19. Les docteurs Tam et docteurs Nou vont parler avec vous après cette presse-conférence. Nous avons décidé que, à cause du conseil de maintenir la distance sociale, que c'était mieux d'avoir seulement 6 personnes ici à la fois. Nous vivons dans une période critique et nos efforts visent à contenir l'épidémie de COVID-19 et à réduire la charge sur notre système de santé et nos professionnels excellents. Notre priorité est la santé et la sécurité des Canadiens. We are taking a whole-of-government approach and indeed a whole-of-Canada approach to limiting the spread of COVID-19 and to keeping Canadians safe. The measures which the Prime Minister announced just now are essential to that effort. And we will continue to adapt our approach to the ever-changing environment in which we all now exist. As Dr. Tam said yesterday, Canada's window to flatten the curve is closing. I urge Canadians to listen to the valuable advice from our public health professionals and public health officials. These are and must be our entire country's trusted sources of advice and information. And what the experts are telling us is that this situation will get worse before it gets better. This is not a time to quibble about federal and provincial responsibilities or about who will pay the bill. Our clear priority is and must be the health and safety of Canadians. And I have to say, I am so proud of how Canadians, from business to labor, from Indigenous leaders to premiers and mayors, and of course our outstanding healthcare professionals, are all rising to the challenge. Team Canada truly is coming together. Together we can meet this challenge, and we will. We must all act now, and we must act together. Starting today, we will be formalizing formal federal government updates as daily briefings for Canadians. We will also provide a daily briefing for all parliamentarians. So now we're going to hear from the Minister of Health, Patty Hajdu, then the Minister of Transport, Marc Garneau, then the Minister of Public Safety and Emergency Preparedness, Bill Blair, et mon cher collègue, le président du Conseil du Trésor et le vice-président du comité du cabinet sur la COVID-19, Jean-Yves Duclos. Merci. We'll be ready to take your questions then.
Well, thanks everybody for joining us, and good afternoon. As Canadians know, the cases of COVID-19 are rising in Canada, and all levels of government have been working together to prepare and support Canadians through this unprecedented health crisis. First, I want to offer my deepest thank you to those on the front line, the public health officials, the border service agents, the healthcare workers, and the many others who are working so hard on behalf of all of us. And I also want to thank all of the other workers who are often unseen and unsung, the cooks, the cleaners, the drivers, and others who are keeping all of the things that we need running. As you've heard Dr. Tam say, now is the time to pull out all of the stops to flatten the curve or slow the rate of infection. Nous devons essayer très fort ensemble. This will be very hard, and it will require much personal sacrifice. And it will require all of us helping in many different ways. Ensemble, nous pouvons aider nos familles, collègues et communautés. The measures that we take together now will protect people in our communities who are most at risk and ensure that our healthcare system can meet any surge in demand. All of us can take actions to reduce the spread of COVID-19. Stay at home. wash your hands well and often, and practice social distancing. I know that many people are worried about running out of food and other essential supplies. Please know that we are not running out of food or other supplies. The Retail Council of Canada is working very closely with our government to ensure that our supply chain remains strong. Please don't buy more than you need in a 2-week period. Remember your neighbors, those people that buy just in time, and buy only what you need. Be kind to one another. Even though this is going to be very hard, Canada is strong, Canadians are strong, and we've been through times that are hard before. The things that we do now that require sacrifice and generosity will get us through this time together.
OK, et maintenant le ministre Garneau.
Thank you. And so let me get into some specifics about travel. Today, as Minister of Transport, I am enacting measures under the Aeronautics Act in order to reduce the spread of COVID-19, especially through international travel. As the Prime Minister stated, effective March 18th at noon, Canada will deny boarding to all foreign nationals on flights to Canada other than transborder flights, in other words, flights from the U.S., and to any foreign national who has resided outside of Canada or the United States in the last 14 days. The measure will not apply to Canadian citizens and permanent residents, immediate family members of citizens, or permanent residents, to air crews, to travelers in transit to another country, and to diplomats. Je veux répéter en français. Dès midi, le 18 mars, le Canada va refuser l'embarquement à tous les citoyens étrangers prenant des vols vers le Canada à partir d'un autre pays que les États-Unis, ainsi qu'à tous les ressortissants étrangers ayant résidé ailleurs qu'au Canada ou aux États-Unis dans les 14 derniers jours. Cette mesure ne s'applique pas aux citoyens canadiens et aux résidents permanents, à la famille immédiate des citoyens canadiens et des résidents permanents, aux équipages et personnels de cabine, aux voyageurs en transit vers un autre pays et aux diplomates. Canada will also introduce screening measures for passengers before they board flights destined for Canada. Air operators must do basic health assessment of all air travelers before boarding, following guidance from the Public Health Agency of Canada. Any passenger, regardless of citizenship, with possible COVID-19 symptoms will not be allowed to board flights to Canada. Les compagnies aériennes devront aussi faire une évaluation des passagers avant qu'ils embarquent dans un avion à destination du Canada et toute personne ayant des symptômes de COVID-19, peu importe leur nationalité, ne sera pas autorisée à embarquer. If a passenger begins to show symptoms during a flight, there are procedures for dealing with this, including notifying air traffic control with details of the situation so that that particular passenger can be met on landing. In addition, effective March 18th at 12:01 a.m., in other words, a minute past midnight on Tuesday, all flights from Europe, Asia, Africa, and South America will be diverted to the Montreal, Toronto, Calgary, and Vancouver airports. Flights from the U.S., the Caribbean, and Mexico can continue to land at their scheduled Canadian destinations. By keeping resources focused in certain locations, we will ensure travelers are being managed as efficiently as possible. We're working closely with the airline industry and with airports to minimize disruptions and inconveniences as much as possible. Passengers who believe their travel plans may be affected should contact their airline for information about specific flights. Domestic flights between Canadian destinations are not affected by this change. I want to thank airlines and airports for their cooperation as we manage this ongoing situation, as well as to all flight crew personnel for their cooperation. These measures will carve out exemptions for certain essential workers who need to travel frequently into the United States. They will be exempted from the 14-day self-isolation. Examples of these people are the crew of any plane, train, or marine vessel crossing the border on a regular basis, truck drivers making deliveries across the border on a regular basis, persons whose profession requires cross-border travel, and finally, we will be considering other necessary essential workers as we move forward. Thank you.
OK, merci beaucoup, Marc. Maintenant, c'est le tour de le ministre Blair. Please, Minister Blair.
Thank you, Deputy Prime Minister. I'd like to begin my remarks today by acknowledging the many questions and concerns that have been expressed by Canadians about the activities that are taking place at our border in order to screen arriving passengers. I want to assure Canadians that from the outset, all of the actions that have been taken at our borders have been informed by the evidence and the expert advice of public health. Based on the advice of public health, on January 22nd, enhanced border measures were implemented at Vancouver, Montreal, and Toronto international airports, and then expanded to all airports on February 9th. These measures initially included asking travelers if they had visited Hubei province in China, and those who answered yes were subject to additional screening. Travelers who had flu-like symptoms were referred to the Public Health Agency of Canada. And as the situation evolved, additional measures were implemented. For those who had been to Hubei, they were required to fill out PHAC contact forms, Public Health Agency of Canada contact forms. They were given surgical masks. On March the 4th, on the advice of PHAC, we expanded the questioning to include travelers from Iran, and then on March 12th to include travelers from Italy. On March 6th, CBSA expanded all of the measures to include land border and rail points of entry. CBSA is responding to the announcement made by Dr. Tam yesterday. Dr. Tam, yesterday afternoon, strongly recommended that all international travelers should self-isolate. CBSA had been planning and was prepared to respond immediately to this direction from Public Health Agency Canada. And here's an example of what Canadians can now expect going forward, as they're being processed from return from international travel. And as they pass through our passenger information kiosks, each of them, all of them, will be asked, do you currently have a cough, difficulty breathing, or feel you have a fever? They will be required to indicate on the form an answer to this question. They will also be asked to acknowledge that they are being asked to self-isolate for the next 14 days to prevent the potential spread of COVID-19. In addition to these measures, there will be enhanced officer presence at all major airports of entry to carry out public health screening and outreach. The officers will be on the lookout for any traveler who looks ill and may refer any suspected cases to public health authorities. In addition, all passengers will be given instructional handouts upon arriving in Canada, and the handout will advise them to self-isolate at home for 14 days, to monitor themselves for symptoms, information on those symptoms, and direction to contact public health authorities if they develop any illness. There will also be increased signage at all points of entry. The important measures that have been announced today, adding additional restrictions, will make the critical work of our border officers far more effective. And for example, by limiting international flights to our 4 main airports, it allows for the concentration and efficient use of our limited resources. As we will identify ill passengers before they arrive, they'll be met at the gate by border security officers, isolated from passenger processing areas, and referred immediately to public health officials. And finally, by significantly reducing the number of non-Canadian travelers, we will see a significant reduction in those traveling to Canada, and therefore a reduction in those who need to be processed. We recognize that this is a difficult and ongoing fluid situation. I want to thank all Canadians for their patience in this trying time. I also want to assure them, as our work proceeds forward, we will do what is necessary to keep Canadians safe, and we will ensure that all of our measures are measured and based upon the best scientific and expert advice provided by our public health authorities. We will continue to work with those authorities, all of our provincial and territorial counterparts, and our international partners to do what is best for Canadians.
Okay, thank you very much, Minister Blair. Maintenant, c'est à vous, Ministre Duclos.
Merci, Madame la Ministre Freeland. Comme coprésident du comité, j'aimerais commencer par remercier tous mes collègues de leurs efforts considérables au cours des dernières semaines pour répondre à cette crise unique dans l'histoire du pays, une crise à la fois sanitaire et sécuritaire et économique. J'aimerais aussi remercier nos partenaires des provinces, des territoires et des municipalités qui travaillent tellement fort avec notre collaboration pour garder les Québécois et les Canadiens en sécurité chez eux. Et j'aimerais assurer tous les Canadiens que le gouvernement canadien va faire tout ce qu'il faut pour les garder et pour nous garder en sécurité au cours des prochaines semaines.
Okay, and I will just say before we take your questions to remind everyone that Dr. Tam and Dr. New will be available to you to provide that expert public health advice as soon as you have finished dealing with us.
Okay, so we're going to take 5 questions from the floor, then we'll go to the phones. Reminder, we're using the microphone. We're going to go Joanna Smith from Canadian Press, and then Marie Vestel, Le Devoir.
Hi, good afternoon. At those 4 airports, when people are being asked to self-isolate, are they going to be asked to self-isolate there, or are they free to go home?
No, what we're instructing them after they have been processed, and again, these are for people who are not symptomatic, but for all others who are coming in, they'll ask to go home and then begin the process of self-isolation. And with the documents and information that we'll give them advice on how that might be accomplished safely and healthily.
And what measures are you taking? I mean, presuming there's going to be much longer lineups now to go through processing. That's crowds of hundreds of people and gatherings much larger than governments are recommending people gather in. What measures are you taking to make sure that airports themselves don't become a vector for disease with these touchscreens, in particular the questionnaires?
Yeah, it's a very important question, and measures are, in fact, being put in place. First of all, as a direct result of the measures that have been taken limiting non-Canadian travelers coming in from international destinations, there will be significantly fewer people that have to be processed. But we are taking measures in the processing areas and in the hallways approaching them to ensure that proper social distancing is practiced there. There will be available CBSA officers, our border service officers, who will be there provided with masks for people who may be symptomatic and be able to take people out of those lines. And as we've also indicated, people who are symptomatic as they arrive will be met right at the gate and not put into those processing areas. I am also aware, and perhaps Mr. Garneau could mention, that other efforts are being made to make sure that the areas in which arriving passengers are processed are regularly cleaned and disinfected to make sure that they are safe and healthy environments for this action to take place.
So perhaps Minister Blair covered it, but essentially we were in touch with the airports last night, and this is for all airports, with respect to trying to lay out things so that there is more social distancing when people arrive at the airport, whether they're on their way in or on their way out, and secondly also that increased levels of disinfection take place at the airports.
Okay, we're going to go Marie Vestel, Le Devoir, and then Lina Deeb, La Presse Canadienne.
Hi, I don't know if this is for Mr. Hajdu or Mr. Blair, mais Monsieur Garneau, si vous voulez répondre, vous pouvez répondre en français. I'll just ask it in English because I don't think you're wearing your earpieces. In regards to travelers from the U.S. who are still allowed to come in, they will not be directed to those strictly 4 airports where you're redirecting traffic. They will be going still to every airport. So are there any extra measures that are being put in place for those travelers, given that Ontario Public Health today said that they have snowbirds coming back from the United States who are contaminated, for lack of a better word in English? What are you doing to ensure that those people who you are still letting in don't just spread out the virus even more?
If I may, all of those in those airports, because there are other international flights coming from the U.S. and other sun destinations that are coming in there, all of those returning travelers will be given exactly the same information. They'll have to fill out the same forms. They'll have to advise if they are symptomatic, and on the form they will also have to acknowledge that they have been advised to self-isolate. There are additional questions and observations that will be made in those airports by our officials. If anyone is symptomatic, there are processes in place to identify them and appropriate referrals to public health. And in every case, all of them will receive information to self-isolate. And that, by the way, is not just those snowbirds, as we often refer to them, people who currently are, maybe spent the winter down in Florida or in Arizona. Many of them will be driving back. That same information will be provided to them as they cross into Canada, ensuring that they understand the need to self-isolate for 14 days. That's the advice that's been given by Public Health Canada, and that's the advice that will be communicated to each and every one of them.
Alors, en français, tous les Américains qui viendront au Canada seront assujettis à un questionnaire, d'abord pour leur demander leur état de santé et deuxièmement, pour qu'ils confirment qu'ils ont été informés du besoin de s'isoler pour 14 jours après leur arrivée au Canada. Ils devront en fait indiquer qu'ils ont reçu cette information avant de pouvoir quitter l'aéroport.
Minister Hajdu, do you want to add anything?
I think that's covered it.
Okay.
Okay, and on that decision to only have other flights, not U.S., so to essentially close the border to any other countries except the U.S. and others, but about the U.S., the Prime Minister has sort of exposed his reasoning for not banning U.S. flights, saying the trade is too integrated. But how does that prevent you? You've been quoting scientific expert evidence. So what is that evidence that prevents you from banning visitors and tourists and still maintaining trade? Why can't you do one and not the other?
Let me take a crack at that on the Canada-U.S., and then I think our colleagues may all want to chip in. So when it comes to the Canada-U.S. border, I think it's very important to say that this is a situation which we are reviewing constantly, in real time, in very close collaboration with provinces and territories, with Canadian business, with unions, and very much with our public health authorities, and of course with our U.S. neighbors. The Prime Minister spoke with the President yesterday and was on a G7 leaders call this morning, and Minister Blair spoke with his colleague, his counterpart, the Secretary of Homeland Security. Canada and the United States have the longest unmilitarized border in the world, and that border, we all know, is absolutely vital to the daily life of people who live on both sides of that border. At the same time, I think both Canadians and Americans understand that we need to constantly be reviewing the practical measures that we can and need to take to protect the health and safety of Canadians and Americans. And that is something that we are constantly reviewing and we are working on. As Minister Garneau said, the strong recommendation to self-isolate for 14 days after coming into Canada from outside Canada also applies to people who are coming to Canada from the United States. We have understood, just because of the way that that Canada-U.S. border in particular is a lifeline for both of our countries, that there do need to be some carve-outs to that strong recommendation for essential workers. People like the truck drivers who are driving trucks of food in both directions across the border. People, as Minister Garneau said, like air crews. There are other categories of essential workers as well, and that is a situation which we are closely and continuously reviewing. Je peux me répéter en français? Non, ça va? OK, est-ce que quelqu'un...
Not still allowing trade but banning visitors. Why can't you just do one and you have to keep both open?
If I may, both of our countries, Canada and the United States, have issued warnings against non-essential travel, and so I think that is very consistent with our approach that would significantly limit the people that you refer to as tourists and others and visitors. And so, but it is an acknowledgement of essential travel, and we also recognize that in these circumstances, at this point in time, that we believe that the risk of those essential workers crossing that border can be managed effectively with the screening that we've put in place and with the instructions and oversight of Public Health Canada for isolation measures where required. And so I think it is important to acknowledge that we recognize that our country's the critical infrastructure and our economies are significantly integrated, and additionally that there are Canadians on both sides, Canadians and Americans on both sides of that border who need, for purposes of their employment and to help keep Canada running properly, to be able to move across that border. But we will put the appropriate measures in to mitigate the risk that may represent to Canadians.
Minister Hajdu, I don't know if you want to add anything.
Just, I think my colleagues have summarized it well. I mean, you know, what's called for is really a continental response, as we know, with an integration of supply chains, and in this case, critical supply chains that include food and essential goods that Canadians rely on every day. What we do on the American border is going to have to be done thoughtfully and in partnership with our American cousins, as well as our Mexican partners. And so this week, I have a scheduled call with Secretary Azar and my Mexican health counterpart to talk about a North American approach. Obviously, there are challenges in this situation that are unprecedented, but I know that Secretary and Azar both believe that we have to be cautious and prudent in how we apply this so that it doesn't pose other health risks to Canadians and Americans that would include running out of essential goods.
Okay, we're going to go to Lena Deeb and then Ashley Burke.
Yeah, maybe I'll try you again on the same topic, Minister Hajdu. Just talking about health and science and not taking into account the goods. I'm still not clear on why are we still letting Americans come into Canada? We're not talking about truck drivers. I mean, they can get specific permits to drive food trucks. Why are we not shutting the border to all Americans when we see what's going on in the States on the health picture of things?
Well, again, you know, we've advised all Canadians to avoid non-essential travel. Our counterparts are in the process of doing the same kinds of measures around the world. I will say that making sure that we get the right specific details about what are essential workers is critically important. That's work that's happening right now, I know, with Minister Freeland and others around making sure that the policies we put into place together is not going to have an adverse impact on the functioning of either of our countries. Listen, you heard my opening remarks. Canadians are worried about their food supply. This is a real thing and a live thing in North America where we have an integrated economy, integrated supply chains, and where both countries rely on each other to provide essential goods that include foods and other products for our homes, etc., including medications. So it's very important that we do this with a degree of precision and in the spirit of a strong relationship that much of the work that we've done in previous on things like NAFTA has been conducted. And that's the work that we're doing right now. We'll have more to say in the days to come.
Peut-être pour ma prochaine, je peux essayer, Madame Freeland. Est-ce que, quand vous avez discuté avec les Américains de la possibilité de fermer la frontière, est-ce que leur réaction vous a poussé à prendre la décision que vous prenez là et non pas une décision plus rigide, plus rapide? Est-ce que c'est la réaction américaine qui inspire votre décision?
Non, absolument pas. Notre décision était une décision qui était prise par les leaders canadiens aux têtes avec le Premier ministre. On a eu une discussion du cabinet entier hier quand on a pris la décision. C'est une décision pour protéger la santé, la sécurité des Canadiens. Et pour nous, pour notre gouvernement, la santé et la sécurité des Canadiens sera toujours notre priorité. Et le Canada, nous sommes un pays souverain et nos décisions sont prises par les Canadiens pour les Canadiens, toujours.
Okay, we're going to Ashley Burke, CBC, and then we're going to take some from the phone.
Minister Hajdu, there's been a lot of talk about that the window is narrow to flatten the curve. How narrow is that window? And as well, does the data suggest that Canada right now is flattening the curve?
Well, thanks. Those are really good questions. And the window is narrow because now we will see an acceleration of cases. We now have community transmission in a number of locations across Canada. And what that simply means is that we cannot actually pin a case to international travel, that we are seeing it spread from community member to community member. And so we are at a critical phase, as Dr. Tam said, because the intent now is to contain the cases as rapidly as possible and to slow that spread. In terms of, so that's how narrow the window. Could you repeat the second question, please?
How to suggest that Canada's flattening the curve right now?
So it's too early to tell. The answer about the curve and whether or not we're flattening the curve, it's too early to tell. What I can say is that the evidence so far suggests that our early measures have been successful in actually being able to pinpoint where cases are and to not have the widespread transmission that we've seen in other countries that have taken either unorthodox measures or not taken any measures at all. For example, we knew we had cases before we had deaths. In some countries, they knew they had deaths before they knew they had cases. And that is a very bad sign. What that means is you have uncontained transmission and people who have been sick for a long time before they die, allowing for further spread. In our case, because we have had a steady progression of measures based on science and evidence, we've been able so far to be able to contain our spread. But now as we see our cases grow through community transmission, this, as Dr. Tam said, is the critical phase. This is why we're calling on all Canadians to take these extreme social measures, including staying home, including working from home, including the cancellation of events. Later, Dr. Tam will make an announcement that we're now asking people to consider canceling events that are larger in size than 50 people, because the time is so critical. And so I would urge all Canadians to do what you can to be part of flattening the curve.
There are a lot of Canadians right now that are abroad trying to get home. They're trying to follow the government's advice and book flights. Some of them have to wait days, and there's a fear out there that they're going to be stuck in another country. That country's border could close down. And as Minister Champagne's been saying, there won't be repatriating Canadians from around the world. Are you talking to airlines to try to make sure they're still flying, getting extra flights there? What is being done to make sure Canadians are not stuck abroad?
Thank you. So we are conscious of the fact that some people are Canadians, are abroad and are having difficulty returning and will have greater difficulty as a result of the measures that we have announced today. So we are talking with the airlines, but in addition about the possibilities to bring people home. It's the very early stages at this point. But also I would say that we are also putting in measures, funded additional consular support and partnerships with on the medical side, so that if there are Canadians that are abroad that could not come home because they were symptomatic and have to attend to their medical needs, that there will be some assistance there from the consular point of view and financial assistance, and that if they have to stay outside the country for a period of time unplanned because they wanted to come home, that there will be a fund to provide some financial assistance to those Canadians.
Okay. We're going to take one more from the floor, and then we're going to go to Marika Walsh for the Globe and Mail.
Hi there. I'd like to get some more information about what the coordination is between the provinces and the federal government. Canadians across the country are getting very different information. I understand different jurisdictions. I understand different caseloads and all of those things. But the Prime Minister said today there's an aligned response, and we're not seeing it. So why isn't Ottawa giving a baseline minimum response that everybody needs to take, and then provinces can increase measures where it's necessary, for example?
Okay, I'm going to maybe ask Minister Hajdu to talk about the very close coordination that is happening on the public health side, and then maybe I'll make a couple comments about cooperation with provinces in general.
Well, thank you for the question, and I will say that that's exactly what's been happening since the very early days when we first noticed that cluster of cases in Wuhan. Dr. Tam convened what's called the special committee that pulls together public health officers from all across the provinces and territories with the federal government to begin that close coordination to prepare for what could and what did eventually become a pandemic. So that coordination is happening, and there are baseline guidance provisions provisions at all different levels, at technical guiding levels for hospitals and for practitioners, a variety of other kind of considerations, including procurement professionals that are working across jurisdictions to make sure we have a scope of the knowledge about what's needed, where the gaps are. That work has been going on since very early January. Of course, we have also provincial and federal jurisdictions in terms of the types of measures that we can take and our own distinct responsibilities. And so the work that Dr. Tam is doing is to try to coordinate a response, but also to recognize that provinces and territories have the jurisdiction to act in a number of ways that is independent of the federal government.
And if I could just add that, we very much recognize, as Minister Hajdu has just said, that there are specific conditions in specific cities, specific provinces. That's why we have public health officers also at the provincial and the city level. And those public health officers are all behaving in, I would say, a very admirable, proactive and energetic fashion. As Minister Hajdu said, there is very good national coordination of all of the public health officers. And at the political level, on Friday, we had a call chaired by the Prime Minister of all of the First Ministers. Since then, over the weekend, I spoke with a bunch of premiers directly, so did the Prime Minister. We plan to now have regular calls at the First Minister's level to coordinate our national response. That's going to be very important. And then just finally, it is so important, given that this is first and foremost a question of protecting the health and safety of Canadians, to be very clear with all Canadians that the federal government absolutely acknowledges the need for federal leadership. We are not going to quibble about federal provincial responsibilities here. The federal government will be there to be sure the Canadian healthcare system across the country has the resources to deal with this situation, whether it comes to our national bulk procurement efforts or the commitment that we have made to provide financial support to the healthcare system.
Okay. Operator, take a question from the line.
Thank you. Once again, please press star 1 on the telephone keypad if you have a question. N'hésitez pas à appuyer sur étoile 1 pour toute question. The first question, la première question is from Hélène Buzetti from Le Devoir, de Hélène Buzetti du Devoir. Please go ahead, your line is open. À vous la parole.
Oui, bonjour. Ma première question est pour M. Garneau. Vous avez reconnu aujourd'hui qu'en restreignant les vols d'étrangers, il y aura vraiment moins de vols qu'avant. Ça pourrait compliquer les choses pour les Canadiens qui tentent de rentrer au pays. Donc, pouvez-vous juste réitérer, le Canada exclut-il de rapatrier par lui-même les personnes? Et si oui, on l'exclut, à quoi ressemblerait cette aide financière dont vous parlez? Est-ce qu'il y aura un plafond, pas plus que 5 000 $, ou pouvez-vous donner plus de détails?
En ce moment, on n'a pas exclu différentes options, mais on commence à parler avec les lignes aériennes pour voir s'il y aurait possiblement un plan pour rapatrier certains Canadiens qui sont à l'étranger, mais qui ne peuvent pas revenir en raison des changements ou parce qu'ils doivent ajouter un délai parce qu'ils sont symptomatiques vis-à-vis le coronavirus. Alors, on est en train d'explorer et on est au tout début de cette exploration avec les lignes aériennes s'il y a des possibilités de ce côté-là. Mais en même temps, on reconnaît qu'il va y avoir un besoin pour plus d'aide consulaire. Alors, c'est quelque chose où nous allons mettre du financement. Et aussi, on reconnaît que certaines personnes vont être obligées de rester à l'étranger pour une période plus longue parce qu'ils sont en train d'être soit guéris ou de passer à travers la période de 14 jours. Et puis, on cherche à les aider financièrement parce que c'est un fardeau additionnel pour eux. On n'a pas établi de plafond, mais on a identifié un fonds et on va avoir plus de détails dans les jours à venir.
Et mon autre question serait peut-être pour Mme Freeland. Vous avez dit que seuls les citoyens ou les résidents permanents pouvaient revenir, puis il y a quelques exceptions aussi. Mais certains s'interrogent sur les personnes qui détiennent un permis de travail, par exemple, ou un permis d'études, qui n'ont pas à proprement parler un statut au Canada, mais qui vivaient ici et qui sont peut-être allés faire un petit voyage à l'étranger. Eux, peuvent-ils revenir au pays?
Les gens qui ont le droit de revenir au pays sont les citoyens, les résidents permanents, les familles directes des citoyens et résidents permanents, et nous ferions des exceptions pour les personnels essentiels. Le ministre Garneau a déjà parlé, par exemple, des pilotes, les gens comme ça. Et
non, mais
il y
je
a
vous parle de
aussi
permis
des
d'études.
autres travailleurs qui font du travail essentiel, qu'ils doivent avoir le droit de revenir au Canada, aussi les diplomates.
Mais les permis d'études?
Les exceptions sont pour les gens qui font des travaux essentiels. Ça peut inclure les études essentielles.
Okay, operator, can we take another question?
Yes, la prochaine question, the next question is from Manon Cornelier du Devoir. Next question is from Manon Cornelier from the Devoir. Please go ahead, your line is open, votre ligne est ouverte.
Oui, ma première question, bon, je ne considère pas que vous avez répondu à ma collègue clairement sur la question des permis de travail et d'études. Alors, si vous pouvez ajouter ça à ma réponse, Mme Freeland, ça m'arrangerait. Mais je ne comprends pas pourquoi on nous parle qu'on veut éviter pénurie d'aliments, médicaments, entre autres pour expliquer qu'on ne ferme pas la porte aux voyageurs américains. Pourquoi on est incapable de dire les touristes américains, eux, seront interdits d'entrer? Pourquoi on ne les interdit pas? Ça n'enlèverait rien à nos chaînes d'approvisionnement et ça ne bloquerait pas les travailleurs essentiels. Alors, j'aimerais savoir pourquoi eux ont le droit de rentrer les touristes américains.
Concernant la frontière avec les États-Unis, quelque chose. Premièrement, on a déjà dit, comme le ministre Blair a souligné, que tous les gens qui vont au Canada d'étrangers, incluant les gens qui vont au Canada des États-Unis, doivent s'isoler pour 14 jours. C'est une mesure forte, c'est une mesure pour tous les gens. S'ils sont canadiens, s'ils sont américains, s'ils vont de la frontière, de la terrain ou par avion. C'est une grande chose. Deuxièmement, comme le ministre Hajdu a dit et comme Dr. Tam a dit pendant la fin de semaine, tous les Canadiens sont recommandés de ne pas faire des voyages non essentiels aux étrangers. C'est aussi une mesure forte. Concernant la possibilité de prendre les autres mesures avec la frontière aux États-Unis, je pense que tous les Canadiens comprennent que c'est une frontière spéciale pour le Canada. C'est notre seule frontière sur le terrain. C'est une frontière essentielle pour la vie économique, la vie sociale, même comme le ministre Hajdu a dit, pour l'approvisionnement de nourriture au Canada. Alors, tout ce qu'on fait concernant la frontière avec les États-Unis, on doit faire des mesures très, très spécifiques. On doit faire du travail spécifique et en détail avec les leaders des entreprises, avec les syndicats, avec les provinces, avec nos partenaires américains. On est en train de faire ce travail. C'est une situation que heure par heure, qu'on est en train de voir ce qui change, mais je pense que les Canadiens comprennent qu'avec cette frontière, on doit prendre les mesures on doit être certain que tout ce qu'on fait ne créera des problèmes dans notre pays, même des gros problèmes pour la santé des Canadiens. Et peut-être le ministre Duclos veut ajouter quelque chose.
Vous avez très bien résumé, Mme Freeland. Je me permettrai quand même, comme l'occasion m'en est offerte, de résumer que les choses vont très vite depuis plusieurs jours au sujet des frontières et des transports aériens. Si je rappelle rapidement, il y a quelques jours à peine, les Canadiens étaient invités à éviter tout voyage non essentiel à l'étranger. Samedi, le ministre Champagne invitait les Canadiens à revenir rapidement au Canada, étant donné que la disponibilité des vols commerciaux était remise en question. Hier, il a été clairement indiqué que tous les voyageurs au Canada, qu'ils soient canadiens ou autres, devaient s'isoler durant 14 jours. Cette disposition a mené à la mise en place par le ministre Blair dans les aéroports, dans tous les aéroports, d'une question additionnelle qu'il a résumée tout à l'heure, la question étant prenez connaissance de cette information que vous devez vous isoler durant 14 jours et certifiez que vous avez pris connaissance de cette information. Donc, tous les voyageurs qui passent par les aéroports au Canada et à Dorval en particulier, depuis hier soir, doivent certifier qu'ils ont pris connaissance de leur obligation de s'isoler durant 14 jours. Je le mentionne parce que M. Garneau et moi-même avons eu des conversations avec Mme Plante, la mairesse de Montréal, au cours des dernières heures. Nous l'avons informée de cette situation qui existe déjà depuis hier. Elle a reçu cette information avec gratitude et je pense que maintenant les choses sont plus claires pour tout le monde.
Et je pense que le ministre Garneau a aussi quelque chose à ajouter.
Oui, sur la question qui a été soulevée par Mme Buzetti et Mme Cornelier sur les étudiants, notre emphase dans la planification de l'approche qu'on prend a été vers les travailleurs essentiels. Mais vous avez soulevé une question importante et on s'engage à vous revenir sur cette question.
Okay, I'm told, unfortunately, that brings our news conference to an end. Apologies to those on the list who did not.
À quel point vous êtes inquiet en ce moment?
And BC wants the ban between the border for visitors. You can respond to that.
Well, I'll speak from the health minister's perspective. I've been working very closely with Minister Dix in BC to talk about an approach that actually reaches our goal of obviously reducing cases and infection in Canada, while also, as I mentioned earlier, maintaining our supply chain. And I know that Minister Freeland has been engaging with Premier Horgan as well on the very same issue. As I said earlier, this is a complicated situation. Obviously, we are working very closely with the United States on ways that we can protect our citizens on both sides of the border, but that also keeps the integrity of our supply chain intact. Obviously, for BC, it is important that they have access to the U.S. market for a number of essential goods, including food, and the same can be said for the United States for many of the things that Canada produces. So we're going to continue those conversations with the Americans this week, and we will have more to say in the days to come. Thank you.
Yeah, in fact, I'd like to add on BC, if I may. Hang on. If I could just add on BC, as Minister Hajdu said, we are in very close contact with the BC authorities. Minister Hajdu is working very closely with Minister Dix. I spoke at length with Premier Horgan over the weekend, working with Minister Garneau. We made some changes, for example, to the treatment of passengers on BC ferries to help with social distancing. We are very aware of the situation in BC, where they are facing a significant outbreak situation. They are next door to Washington State. Premier Horgan has a very good relationship with the governor of Washington State, and they are also in constant contact. At the same time, as Minister Hajdu said, BC, like every single province and territory in Canada, has extremely close, extremely dense social and economic connections, human connections with the United States. We need to, in taking actions on that border, act with real care, with real delicacy, and with real precision. The fact that we are saying to all visitors to Canada and all returning Canadians that they are strongly recommended to go into 14-day self-isolation means, self-isolation for 14 days in Canada, that I don't consider to be something that a tourist would like to do for a holiday. This is serious for everyone traveling to our country, and we are advising Canadians only to undertake essential travel outside the country. We are very carefully reviewing the situation at our shared border with the United States in close collaboration with our American partners. We are saying to Canadians, let's take measures here to protect ourselves and protect our neighbors. That applies to the people who live next door to us, and the Americans live next door to us. So we are working closely on this, but I want to emphasize to Canadians, and I think Canadians understand this very well, it is a dense and close relationship, and measures that we take there will be carefully thought through. It is important for us to be mindful of the really close connections. For example, as Minister Hajdu has said, food supply in Canada is very closely connected with the U.S. economy, and the U.S. food supply is connected with greenhouses across Canada. So we need to act with great care and deliberation, and we will also act with alacrity. Okay. Merci. On sera ici demain.
All right, so the end of a news conference there with federal